Town Hall virtual meeting. Today is April the 14th, and we really appreciate all of you for joining us. Let me just give you a number if those who want to join us via telephone. That number is 857-799-9641. So again, thank all of you for joining us. Again, for our town hall meeting, we thank you week after week after week as we continue to give updates and give out information pertaining to this pandemic that we have with this COVID-19. Tonight, listen, there's a lot going on. We saw what's been happening on the news with CDC, with this Johnson & Johnson vaccine. So we're gonna have a conversation about what's going on and why you still should not, feel too alarmed about it. And also we want to talk about some of the vaccines that we have been indulging in here in the city of East Orange from day one. Just this evening we have Victor Cote, which is our health officer. We also have our good friend who represents the East Orange General Hospital, Dr. Mehta, and we really thank him. He's the Chief Medical Officer at the hospital. And again, our Dr. Griffin, who is not joining us tonight because she is at a vaccination site, doing what she needs to do in terms of keeping people safe. So again, we are very grateful for her over the past year being on these Zooms. So with that, again, I'm Mayor Ted Green, and I'm just going to go over some of the numbers, and then we're going to go right into our conversation. And then what we want to do before we close out tonight, really give you some updates on what some of the things that the city has to offer from our programs and what programs are opening up here in the city of East Orange for those who are interested in getting children in our recreational programs, and also programs for adults, and also programs that will benefit our adults, our seniors, our teenagers, and our young people. So with that, let me get prepared to go over the numbers for today. As of today, April 14, 2001, we have confirmed 6,614 positive cases, and out of those cases, 284 resulted in deaths. In our first ward, we have 1,080 cases. Second ward, 1,102 cases. Third ward, 1,250 cases. Our fourth ward, 1,238 cases. And in the fifth ward, 1,317 cases. In Essex County alone, there are 82,132 cases. 134 cases, and 2,541 resulted in deaths. In New Jersey alone, the positive cases are 845,201, and 22,414 resulted in deaths. So what do that mean? We have to continue to wear these masks. We have to continue to practice social distance. We have to continue to protect ourselves and protect our loved ones. We've been doing it now for a year, and in a few weeks, we got to continue to folks get vaccinated, which we have been driving that point in terms of vaccination. And again, that's going to really drive us right into our talking discussion tonight in terms of the vaccination and what's going on with this Johnson & Johnson. So with that, I'm going to just again, Dr. Mehta, how you doing today?
Mayor, it's a pleasure as always to be here with you.
Thank you so much, man. We thank you for always taking time out of your schedule, because I know how it can continue to be busy over there where you at the East Orange General Hospital. And we're looking forward to your conversation around what's going on with some of the cases and what's going on with the Pfizer, Moderna, and this Johnson & Johnson. We're looking forward to it. But I also want to just say hello to Vic, who's been with us really every week, and Vic is going to talk about also some of the sites and the experience that people have experienced. And then what I want to do tonight, I want to get on the calls a little early tonight and allow folks that has been joining us a little more time to ask questions and get their questions answered tonight. So I'm going to go right into this with you, Dr. Mehta. I would like us to begin with this discussion on a lot of the positive results we're seeing from the vaccine. Tell us about how the vaccine has been the key in fighting COVID-19 and why.
Again, for inviting me over to this forum to talk with the rest of the town. The vaccination is one of the only methods that we will be able to get out of this pandemic, along with masks and social distancing. So far, we've gone in a stepwise manner with regards to vaccination, whether it is first we started off with healthcare workers and 18 over 65 and right now, I think it's virtually pretty much everyone who can get over the age of 16, because that's the approval for Pfizer and about 18 for Moderna. In the state of New Jersey, about 2.3 million people have been fully vaccinated that we completed both series of Pfizer or Moderna or one dose of the J&J. And just about 1 more million, so about 5.5 million doses have been administered in the state of New Jersey. That is pretty commendable, and we continue to work towards it. Even at Eastern in general, we've administered north of 6,000 doses to individuals, and that seems like a small number compared to the millions, but again, remember, this is us trying to make it happen as a strong entity within the city. We've partnered with through our website, we've tried to get as many registrations as possible, and now we are working with Dr. Griffith and also with some of the clergy to try and see what we can do for the city and get people vaccinated locally as much as possible again. J&J, the Janssen vaccine that came out, this was the last one to come into the phase with a single-dose vaccine. The mechanism of action was different than the mRNA vaccines, that is Pfizer and Moderna. And I'm sorry, I'm going a little technical here, but the mechanism by which the J&J vaccine worked was different than the way Pfizer and Moderna vaccine worked. And it had a very good safety profile, which was studied in the study that led to its approval, and it gave about 85% protection, which is pretty good. However, what has happened since it's been released, one of the things that has happened is that we've had 6 cases of thrombosis. What it is clots that form in person's blood vessels. So there were 6 cases that happened that we know about. And that led to everyone taking a step or a pause and saying, you know what, out of abundance of caution, we should evaluate this further before we recommend it again for mass vaccination. So what has happened is not that the vaccine is bad or that there is issues with it per se, but they are trying to study it to make sure it is safe to administer. And I can give you a very rough comparative measure just to show you how sensitive we are to making sure it is abundance of caution. The vaccine causing clot is about 0.09, possibly 0.09 incidences for every 100,000 vaccinations. Compare that to if you were on an oral contraceptive pill, you have 2.7 to 40 chances for every 100,000 people who are on it. So meaning that the vaccine is much safer than the oral contraceptive pills that people are taking. However, given the fact that it is a vaccine and it is something that we need to get people's trust in, decision was made to be, out of abundance of caution, to pause or halt it till we have further evaluation of the study. Now, the COVID disease itself is very much active in the community, and we are seeing it still in the hospital. We've gone from having just 1 patient in early January, early February, to now up to about 10, 11, 12 patients on a daily basis. that we see and we take care of. And they come from different areas of the city. So the point that I'm trying to make is people are still getting sick. The pandemic is not over just because we've not talked about it as much as we used to before, or because we're not in lockdown, doesn't mean that it's over. It's still very much in our midst, and we are in the middle of the pandemic.
Great, right. Yeah, because, this week alone, there have been so many people that, took the vaccine, the J&J, so I thought it was important for us to, just to ensure people that, just, the information that you could provide to keep them,
Right.
safe in terms of the Johnson & Johnson. And I knew many people are going to have questions about what happened, so thank you for that information. How long does it take your body to get immune after being fully vaccinated? How long do it take?
So, with the two-dose vaccine, the Pfizer and Moderna, I'll talk to you about that. 2 weeks after the first dose, it's about 45 to 50% protection, and about 2 weeks after the second dose, it's about 95% protection. And that's pretty significant. And what we have noted is not just the protection from the disease, but in the 5% chance that you actually do get COVID-19, it's going to be 100% chance that it is going to be less severe than it would have been originally been. So we are seeing less hospitalization in the COVID positive cases. We are not seeing actually any hospitalization in the people who have been vaccinated so far. But we are still seeing COVID in the community.
Let's talk about our teenagers for a few minutes. Are you seeing any, when we say teenagers, I always say 17 and down. Are y'all seeing any high cases of our young people coming into the hospital being exposed to COVID-19?
So we are an adult medical facility, so we see in the ER we see every age group, but for admissions they tend to go to either university or Northwest, where they have pediatrics on the in-hospital side. We generally take care of the kids only in the emergency room, so they come in, they get tested, and they test positive. So we are seeing that, yes. But in terms of symptomatic, we're not seeing symptomatic kids. I've not heard of kids getting transferred because they were very, very sick before.
Right. So, all right. Well,
but it is in this.
Right. So if you had to rate that number in terms of our young people, 17 and down, that is coming into the hospital, what would be that percentage? Is it 2%, 4%, 10%? What's the percentage?
So we see about 6% of our population that comes into the hospital is a pediatric age group. So that's our general percentage of the patients who come in pediatrics, who are below 18. I'm sorry, I should call them teenagers too, but generally they are in the 6% range. Yes.
Great. Also, is it possible to contract COVID-19 even after you had the vaccine? Let's talk about that, because some people, have this theory out there that you still can catch the virus.
So the vaccine does not give you the virus. And it's very important that we mention that, because a lot of myths around the vaccine is that you're getting the virus. That's not true at all. It is the farthest thing from the truth. The vaccine, that the mRNA vaccine is for a specific protein on the virus. And that's one of the reasons why the antibody test, which checks for some other protein, does not come positive, because the vaccine is giving you another protein. So just two different things. Now that being said, there is a 5% chance you can still get COVID after the vaccine. But there is a 100% chance that if you get a COVID infection, you will not have a severe infection that would cause you to go into the hospital or get onto a breathing machine. And that's what is important, that you want to make sure you avoid the complications of the COVID virus.
Yeah, most people are still, asking, when can we take these masks off? And right now, it's not a good time. Yeah. But what would be your advice? Because people want to take these masks off, and we know we can't.
I think it's a very, I hate to be the person who takes away hope, but the masks are here to stay at least through 2022.
Wow. All right.
Yeah. So 2021, you can't get rid of your mask if that's what people were hoping for. It requires all of us to do our part. And I'll be honest with you, if one part of the country doesn't do its part, it hurts every other part of the country.
Right. There's some folks who came on late. Darlene, Fagger, I know you just asked the question about J&J. Those who came on late, we did have Dr. Mehta talk about the J&J and the vaccine, and we hopefully we'll talk about it again. So we don't want folks to think that we did not bring up the conversation about the J&J and what's going on with the J&J and why there was a small suspension temporarily on the J&J vaccine, and we'll get to that. Hey, Dr. Mehta, you know, listen, this is a new mutant trend going around, strain of this COVID-19. Will the current vaccines protect you or protect us from contracting a different, strain of this new COVID-19?
So the answer is yes, but we are cautiously optimistic. So the Pfizer vaccine was tested against the against the UK variant, and it was found to have protection. The UK and the New York variants are the two dominant strains in the US right now, and the vaccines do protect against those two. We are watchful about the South African variant. And see, this is where the longer it stays out in the community, the coronavirus, the more it stays out in the community among the people who either are resistant to getting the vaccine or not getting vaccinated, but they get the coronavirus, the more chances are that the virus will mutate inside these people. And we'll keep having spikes of these things. So I don't like to take hope away, but at the same token, just for the purposes of the community, I want to make sure I am transparent about what we are looking at. Mayor, one more thing that I forgot to tell is that if you did get the J&J vaccine, do not worry. Just because you got the J&J vaccine does not mean that the complication will happen with you. In fact, in US, we've not had a single case of this. And so it's not that you need to worry about it. Make sure you report your symptoms. All of you who have gotten vaccination would have gotten a link to register yourself on the CDC website, Be Safe, and they monitor everyone from that website. So that's a great tool to make sure that the data is collected for the whole country and it's monitored accurately.
Right, and I'm glad you reaffirm that, folks don't have to worry about it and that they can just continue to, if they are experiencing any symptoms or any difficulties, just call your doctor immediately, And what we don't want to encourage or disencourage those folks who have took the Moderna or the Pfizer. We want to encourage folks to continue to protect yourself and encourage those who are going to get the vaccination, just continue to follow the scientists, just continue to follow the CDC. Our governor, who has been coming on regularly, Governor Phil Murphy, giving us updates. And listen, every week we are on this meeting, virtual meeting, but every day we're putting something out. So just stay on our Facebook page, our Instagram, and we're going to make sure when we get information that the city of East Orange get information. Listen, Dr. Mehta, I know we've been on this Johnson & Johnson. Is there any other advice that you can give or any other scenario to just ensure people that everything is going to be all right?
It will be. We've been very resilient. Amir, I can still remember one of our first town halls just about a year ago.
Yes.
And it was such a tense moment in the command center where we were assembled. And we've gone a long way since then. And we've learned a lot of things. We've gone through a lot of things together. We are a resilient group of people, whether people realize it or not. You guys have been resilient. You've been through this whole process for a year, and you're still going strong. Get the vaccine, okay? This is not an experiment. This is not something against somebody. It is truly to make sure that you're safe. I'm going to speak something which is not considered politically correct, but we have to say this. This is not a political statement. You have to realize that amongst black population, amongst Hispanic population, the rate of bad outcomes, meaning whether you get bad breathing issues for life, or you have strokes, or anything, or even death, is higher than the general population with COVID. And this is important, and the only way we're going to prevent it is wearing the mask. The other incentive that I can put out there is that if everyone in that group is vaccinated, the CDC says that you can actually meet without the mask on. So think about it. You can actually go and hug your grandchildren, and they can come if you're all vaccinated. If your pod, if your group of people that you hang around with is vaccinated, you can meet without masks. Isn't that what we want to get to? And that's important, that we get vaccinated as quickly and as expeditiously as we can. That's it for me, Mayor.
Thank you, Dr. Mehta. And listen, I can attest to that also in terms of all of us want to get back to some normalcy. You know, I constantly say to my city, just hold on, hold on. We've been doing it. I'm just asking everybody to have more patience. I'm just asking everybody to continue to wear those masks. And when when you're around a group of people, look, just stay safe. We're gonna get there, but it's taking us time. But the number one thing that we don't want to lose anybody else. We don't want to see anybody else in the hospital or have to be home for 14 or 15 days. But we can do this together, and it has been very tedious, listen, I got exposed to it, and it wasn't an easy task, but again, we're here, and I, as long as I got breath in these lungs, we're going to continue to make sure that we push the information, but also we need all of our folks here in the city to do what they have to do to get back to some normalcy. What I want to do, Dr. Mehta, don't go nowhere. Stay right with us. Those who are just joining us, thank you for joining us on our weekly town hall meeting, COVID-19. Again, today is April the 14th, 2021. We thank you for joining us. We're here with Dr. Mehta, who is the Chief Medical Officer of Eastern General Hospital. We also have with us today Victor Cote, who is our health officer. I'm going to go right to Vic. Vic, listen, give us an overview and an update on the vaccination sites, and then we're going to start taking some calls from those individuals who are waiting to get their questions answered. So, Vic, give us an update on where we at, what we've been doing, and how's things looking when it comes to the vaccination.
Thank you, Mayor. At this point in East Orange, only about 9% of East Orange residents have been fully vaccinated against COVID. Another 10.25% have received one dose of vaccination. About 20% are partially or fully vaccinated, so they may have received one or both doses of any of the vaccines. And at this point, also, we are at this time working with, collaborating with FEMA at the St. Matthew's AME Church in Orange to vaccinate residents of East Orange, Irvington, and Orange. And so we are also imploring every resident to please avail themselves of the opportunity. The second dose is what is going on now at the church. Please, if you have received the first dose of the Moderna vaccine at that church, please do come back for the second dose. Just like Dr. Mehta has just reminded us, with the second dose, your immune protection goes up to 90%. So we want you to be fully vaccinated. We don't want you to take one dose and feel that and have this feeling that you are fully covered when you are not properly protected. We want you to be fully protected against COVID. Also, we all know that at this time also that Essex County is vaccinating at the Essex County College and at the Donald Payne Senior School of Technology. in Newark. Those two sites also cover East Orange, Irvington residents, and Newark. And also, please do go to those sites and get vaccinated. The health department has also been rolling out vaccinations for our homebound residents with the J&J vaccine. Unfortunately, the J&J vaccine is on pause at this time, and so we're looking to work with our collaborators from the county and the state to roll out a Moderna vaccine in the future. As soon as we have this up and running, we will send out our flyers again and remind our residents to come to the location which will be announced for this vaccine. Hopefully we can do this very quickly. We want to increase our numbers from 9% to as high as over 50%, and know our residents are protected. We are also asking our residents to please call the Division of Senior Services at 973-266-8832 to register for our vaccination sites and our vaccination program. And register also your seniors that are homebound, so that once we have vaccinations available, we can reach out to them. We have a mobile truck that can be used for this purpose, and we would make every effort to reach out to every homebound resident and have them vaccinated. Once that is done, we would begin to look at our boarding homes. We're going to one at a time and see that they are also vaccinated.
Thank you so much, Victor. And listen, I know how hard the health department has been working, but I want to give that number out again about senior services, those who want to get a ride, those who need to get vaccinated. Call 973-266-8832. That's the number, all right? We're going to post it also. What we do weekly is try to make sure that every number that we talk about on this trend, we make sure we post it and make sure you have it. So Vic, let me ask you, you know, although we've been working very hard on the vaccination, getting people to the vaccination, what else is, you know, when people get fully vaccinated, right, and they take their second shot, is there some database that shows that they took the second shot, and is there a register?
Yes, there is a register for all the vaccinations that you have received. The NJIIS is a state-based database that we upload all these informations into. And the vaccination card that you are given is also an evidence that it has been uploaded into the state database and the state is aware of it. So if you call the state, or we call the state, we can also track your vaccination, how you're doing with your vaccination. It can be tracked easily.
So let me ask this question, right? If someone was out of town, I'm sorry, Dr. Mann, if someone came from out of town and they took the first shot of the Moderna, now they're from out of town, can they get the second shot here in New Jersey or here in East Orange, or they would have to go back to where they took the first shot?
I believe they can get the second shot wherever they are in New Jersey.
Okay.
Yeah, the thing is that the first shot has to be tracked from their, on the database. If it's coming from out of state, they have to have evidence that they have had that shot. And I believe if they have to go back to their state to get it, but they can, if they can't, there must be a way of getting it in East Orange, in New Jersey.
Okay.
Yeah.
I know, I hope I'm pronouncing right, Shanna had a question in reference to if somebody took the first shot and they from out of town, and I'm quite sure it could, because all the vaccinations is the same, like the vaccine, right? Mm-hmm. Okay, yeah, so yes, you could. Dr. Mehta, you was ready to say something. Go ahead.
Yeah, I was just going to say that to the tracking mechanism,
The New Jersey, the NJIIS, what Victor mentioned, actually tracks the data and provides you reports for each site of how they are doing with their second dose tracking. And, I mentioned we've given over 6,000 doses. We have a 95% second dose rate, which is phenomenal. They want you to have at least 90%. We've had 95 plus percentage. And it's important that people, and the other point that if you got a Moderna, and you try and get a Moderna, but if you get a Pfizer, that's okay. But the preference is that you get the second dose, the same brand that you got the first dose on. But you can get it anywhere else. They'll just track it and they will administer it. They should.
Great. So let's do this. I want to go right to our telephone calls and to our Facebook page. So Connie, let me have some questions. Those who are waiting on our line to get some their questions answered, please.
Okay, this question is for Victor. Sheila Campbell-Smith would like to know, how do we know only 9% of the people in East Orange have been vaccinated, especially if people are going to different areas outside of East Orange and Essex County to get the vaccine?
Yeah, again, Dr. Mehta just explained it to us that there's a tracking system at the state level that collates information from all these sites, all the hospitals, pharmacies, all around, and as long as you're using your address, they can track that you're coming from East Orange, and that's very, very important, address and zip code. So if you are living in East Orange and you go to Newark and you use the Newark address, it's going to reflect on Newark, not on East Orange. So the tracking system is there, and all this information are all going to the state. And what the state has started doing, I think this is the first time I'm receiving this information myself, is that they're trying to now give people an idea of, statewide, where are we at statewide. So, and that helps us to understand where we're going so that we can make some effort to achieve that. And the state also, knowing that, they are now making more efforts to look into those areas, those municipalities where the vaccination levels are not at where they should be, and they are making every effort to help us out. So they're doing everything, to ensure that our residents get vaccinated.
Okay.
Thank you.
Now this question is for either Victor or Dr. Mehta, and I don't know if either one of you will know the answer. Carolyn Cornelius would like to know, and a few others, exactly how long will the vaccinations last? Will booster shots have to be given?
Dr. Mehta, do you
right
have?
Now? Yeah, right now it's a theory. Okay, the theory is that if we get rid of the virus altogether, we won't need booster shots. However, the rise of the variant, the lack of people getting the vaccination, the fact people are not just even adhering to masking and social distancing, makes me feel like we may end up in an annual vaccination, kind of like the flu vaccine scenario, where you will need a booster dose every year just to make sure you're covered for the variants that are out there.
Okay.
This is no different than the flu vaccine, so people shouldn't get scared or upset or nervous about it. It's not a bad thing. We need to make sure we cover ourselves so that we don't get sick. That's it, at the end of the day.
Okay, thank you, Dr. Mehta. Victor, the schools are scheduled to reopen next week where students can come back to in person. Do you know, can you talk about that a little bit? I'm not sure if you are able to speak about that. Like, is it going to be every day, 4 days, every day, hybrid schedule?
Yeah, at this point, we actually haven't had that meeting with the school board of ed, but I believe that when the schools eventually open, there will be some that will be coming, fully into the school, some that will be hybrid, and some that will be, maybe schooling from home. So I think that's what it's going to be at the end of the day.
Okay. Actually, Mary, you covered other questions already previously, okay. So I do have a question that's not COVID related, so if you want to wait until later, you can, or you want me to address
No, go ahead.
it now?
Let's go.
Okay, Tashonda Zarita is concerned. She lives she lives on North Munn near the old police department, and she's concerned about garbage and garbage being thrown out of people's cars and getting on her grass in the morning, and just what can she do to remedy this situation?
Right. Look, first of all, thank you. That's, one of our #1 priorities when it comes to keeping our city clean. If you can, please call my office at 973-266-5151. And if you do see someone throwing garbage out and littering on our city, please call the police department at 973-266-5000. Or, listen, if there's a license plate, take that plate down. We don't want anybody to get in, in harm's way. But, that is a problem in our city where people feel that they can throw trash, or they can take a bag from their personal house and put it in the garbage can or the receptacle, which we're asking folks to, be conscious of how you treat our city and how you treat your city. We think it's important that folks do what they do if there was in any other city, So again, keeping our city clean, trying to get back to the cleanest city in the nation. We need your help. But again, the person who are concerned about those people throwing trash, just report it. If anything we could do on our side, we're going to do what we have to do. But again, thank you for just being concerned about the cleanliness of your city.
Okay, I spoke too soon. I got a couple of more questions.
Okay.
Doctor, related to COVID-19. Dr. Mehta, Darlene Frazier said that she just received the J&J vaccination on Monday, and of course it was paused on Tuesday. What symptoms should she look out for?
So anything that makes you feel out of the ordinary. So if you have like intractable headache, if you have swelling of the legs, if you have difficulty breathing, or if you have chest pain, you need to come to me.
Okay.
Essentially.
Now, another question related to herd immunity. Will the United States ever reach herd immunity this year, next year? Is it even possible?
It is. I'm very hopeful for that. Vaccination is going to play a major role. If you have paid attention, if you listen to the president, if you listen to the chief minister, to the governor, what they're asking is a 70% vaccination by end of June target. And the reason why they are requesting that 70% is that will help us achieve herd immunity status. I'm very hopeful that we will get it together.
Okay. Mayor Gabrielle Nola Diggs would like to know, how can I find out how to start a business in EO?
Yes, and thank you. We've been opening up small businesses for the last few months here in the city of East Orange. If you get an opportunity, please call our Department of Policy, Planning, and Development and speak to Dan Jennings. Let me give you that number. That number is, call my office, but Dan Jennings is the Director of Policy, Planning, and Development, and he can really walk you through what you need to do to start a business here. And we thank you for even wanting to be a part of the movement right here in the city of East Orange with our small businesses. So please call 973-266-5151. You're going to speak and ask for Justin Brown, and he will direct you to Policy, Planning, and Development, so what we can give you some information and start you on your way.
Okay. And I also put in the comments on the direct line to Policy, Planning, and Development. It's 973-266-5140.
Right.
Okay, this one just came through.
I know we have one on there.
Booski, you see that one, Mayor?
Yes, Davis
Yeah.
talking about address the noise increase in pollution. I get it. I hear you. We're trying to do all we can with our police department. We know you know, folks come through our streets with the new, you know, this motorcycle sound. You know, just help us by calling our police department. There is a noise ordinance that we have in place. You can call property maintenance if it's in your building, but if it's on the street, please call our police department. Please speak to our chief, Chief Bendy, 973-266-5000. Give us a call, or again, property maintenance under Director Mark Barner, 973-266-5320. All right, you know, we're doing everything we can to stop these folks from really intriguing on our evenings and sometimes during the day, but we're doing everything we can. But please call the police department.
Okay, Valerie Wilson wants to know, whatever happened to the signs informing people to clean up after their dogs? People are walking their dogs, leaving a mess in other people's yards or at the curbs. It's so disrespectful. Right,
and you're right, truly disrespectful. But let me just say, under our director, Chris Koch, and Muzamil Muhammad Stevens, our Department of Public Works, our Department of Code Enforcement, we have been enforcing it. We're going to continue to enforce it. But listen, East Orange, you know what's right and what's wrong. If you're out there walking your dog and you know good and well you're not picking it up, you're part of the problem. We're asking you to help us out. There's so many people that do their part where they pick up after their pet, and we're asking you to do the same thing. But what we would do is make sure that we put more signs out. But listen, we know what's right from wrong, and we know if somebody walked their dog and their dog walked on your property and did what they had to do, the first thing you would do is be upset. So you have to think of the same way that you wouldn't want it to happen to you or on your property or your establishment. Treat people the same way. But what we would do, give us that address. You can come offline and call the Department of Public Works, 973-266-5330. Chris Koch and his team is on our Facebook tonight. They will give you a couple numbers, but we do all we can. But again, East Orange, we're better than that. We're better than that, and we're better than that. Help us out by curbing your dog and, you know, picking up behind your dog. You know, thank you. We appreciate it.
Okay, well, this is a good segue. This next question from Nat. Mel Boone wants to know, who can address the raccoons in the area?
Right. That's our health department. I'm gonna let Vic elaborate on that very quickly, but that's our health department. Go ahead, Vic, talk about the raccoons and also talk about the rodents while we're at that.
Yeah, the raccoon issue would refer to the animal control. The animal control division is under the police department at this time. But one thing I want to just let you know is that once you have wildlife that is established within the municipality, it's unlikely that the animal control would remove them and throw them far away. Actually, the Wildlife Society does not permit that. So what you want to do is remove all sources of food, water. If you remove all that from your environment, all the trash and all that, they would relocate themselves. They would just move away from your neighborhood and go elsewhere. So as long as you don't provide the food for them to eat and water to drink, they will move elsewhere. That's one thing. But the other thing is that we are going to refer it to the animal control. We'll get them involved and ensure that they deal with it. With the rodent issues, please, again, call the health department, 973-266-5480, and we'll get our inspectors out to inspect the location for areas of harborage and ensure that those conditions are taken care of. Again, the same goes for rodents. If you remove their sources of water and food, they will definitely relocate. Where we find that they are entrenched, we would probably have to put black boxes there and orbit that whole area for to get rid of them.
Right, and thank you, Vic. So, East Orange, we need your help. We're doing everything we can through our cleanup team. We're doing everything we can by putting out the reciprocals and the garbage cans throughout the city. But we are asking those individuals who put garbage out with the bag and not in a garbage can to help us out by putting the lids on there. We asking you, don't throw trash on the ground. If you are a resident or you are a business owner and you need a garbage can in front of your store that will help people put more trash and litter in those cans, please reach out to our DPW department. Chris Cope and his team will help you get a garbage can, but we have to do our part, and we're going to do our part on the city side. I do want to address one thing. I know folks have been talking about, these stop signs, the yield signs, these speeding signs. We're doing everything we can. I know that there are several signs that we did get information on, and I know that our police department has the information, DPW have the information, Mayor's Office of Constituent Service have the information. We are trying to get these stop signs back up. We're trying to get these yield signs back up, slow down signs, so we are getting them up. If you are having those problems in your on your block or on your street, just reach out to my office, 973-266-5151, and we'll make sure we take the information and get it to our DPW department. With that, Connie, do we have any more questions? I know that Victor and Dr. Mehta has really been engaged with some of the questions that came through tonight.
Yeah, I just want to say on behalf of Police Chief Phyllis Bindi, who's also on, she's texted me to address the animal control issue, just to reinforce that the animal control officers are out there. We have 3 of them. It actually happens to be National Animal Control Officer Appreciation Week, and we just want to thank them for the great job they're doing. And so if you do have an issue with an animal that needs to be dealt with, you would call the police department at 973-266-5000. Okay? Mayor, Roxanne Barry would like to know if her 2020 parking permit will be honored in 2021. And
yes.
What if she's moving in May?
Yes, it will be honored. If you get an opportunity, please reach out to Melody Scott. But the permits are being honored, and give her a call at 973. The Parking Authority also, but you can also call Melody Scott at 973-266-5151, or you can call the Parking Authority for information at 973-672-1116. But those parking permits will be honored in 2021. Right, the ones that was in 2020 will be honored in 2021. Yes, they will. And also, let me just talk about one more thing that folks have been calling my office about, and that is the home repair program. Folks been calling the mayor's office about home repairs. Yes, we do have a grant in the city of East Orange for those homeowners who are interested in getting repairs on their house or their home, income eligible. So again, please reach out to the Office of Policy Planning and Development. That's Dan Jennings' office, and you can get all the information. So if you're a homeowner and you're in need of home repairs, it's a forgivable loan, but again, we do have funds, but income eligible in terms of getting the funding, all right? So we do have that. So listen, we thank everybody for coming on tonight. We thank everybody week by week for being a part of this conversation, this COVID-19, and all of us who have joined in throughout the last year and a few weeks now on this pandemic that we all went through. I appreciate all of you. I appreciate your questions. I appreciate your concerns. But again, we're still in this together. And as I always said from day one, as your mayor, We started together. We're going to end together. We're going to get through this together and continue to tune in. If there's information, good people, that you want to attain, or there's any questions that you need to know what's going on in this city, if you don't come on our Facebook Live on Wednesday, feel free to call us. We're going to do whatever we can to try to help you or assist you. Look, if we missed a call one or twice, that's not intentionally, call back, because I can tell you, we want to do everything we can to provide our community, this community, with information that will help you, help your families, and help us move our city along. So again, with that, what I want to do, I'm going to ask Dr. Mehta and Victor Cote to just give us some closing remarks. And once they too give us some closing remarks, I'm just going to close out with a couple of updates and some information on where the city's doing and the things we have, as I said earlier. Then we're going to close out to next week. So Dr. Mehta, please just close out. Anything you want to talk about, any information that you want to give our constituents and those who are following us on our Facebook meeting tonight, or if there's any things that are going over at the hospital that our constituents need to know about, please give it to us.
So a couple of things. The disease is still there. I do want the constituents of East Orange to know that COVID is still, we're in the midst of the pandemic still. If they get a chance to get the vaccination, they should totally get it. The other update from this hospital that I want to give you is we invested in and are able to state that we now have board-certified critical care specialists taking care of our patients in our ICU. We've invested in a team to come and help us with our ICU care in the hospital, and we also have invested in a team of physicians who are all board-certified to take care of our patients in the hospital, or the hospital. So that's two big investments that we made in ensuring that the direct physician care that is given to patients is now changed and now different, and we're just waiting to see how it evolves, but we can make sure that you get expeditious care when you're in the ER and even afterwards when you're in the hospital. Thank you.
Dr. Mehta, thank you as always for always being here for the city of East Orange. Always have been on the forefront with us with this COVID-19. We appreciate you. We're going to close out, but don't go nowhere. Vic, can you give us some closing remarks, please?
Thank you, Mayor. In addition to what the Mayor just mentioned about home repairs, I just want East Orange to know that the Health Department also has a lead abatement grant. We've had this grant for about a year plus now. If you have been cited for lead abatement and for lead violation, and you need that house or apartment abated for lead, please call our Health Department, 973-266-5480, to see if you are eligible for this grant. And it's money that is there for lead abatement. And see if you are eligible. It's a great way. We want all our houses abated for lead as much as possible. The second thing I want to say is this: please, if you have been vaccinated against COVID, partially or fully, you still have to use your mask, maintain social distancing, wash your hands, use your hand sanitizer. We still have to go through all that until we reach the herd immunity and the state declares the pandemic over. But up to that time, we would have to obey these regulations.
Thank you so much, Vic. I just want to answer Ms. Mitchell. She had a concern about our roads. Ms. Mitchell, thank you very much for that concern. Listen, we had a rough winter with this snow, but we are slated to do almost 6.0 miles of repaving our streets. We're going to have guys out there making sure they fill these holes up. We apologize, but listen, last year has been a year that all of us will probably never forget. you know, from this COVID to the snowstorms. So again, we will be out there soon as the weather breaks, and you'll start seeing our streets being repaired, and paving and milling is coming real soon. We did a very excellent job last year with our paving and milling. We'll be out there, but if you ever have any questions, please call our DPW department, 973-266-5330. Speak to Chris Cope. Also, let me just, Millie Torres, in terms of the, I just want to make sure I'm right, because I saw that question in reference to your concern. Fixing pipes. Please call again DPW, our water department, in reference to your pipe situation, and I'm quite sure they will help you to assist you in terms of if there was our mistake, if the water department mistake, they will assist you and guide you in the right way. So again, Miss Millie Torres. So with that, East Orange, we're going to close out. Let me close out with some information. Cdl Training Opportunities, right? If you're interested in getting your Cdl license, please call well, let me just say, the training will take place on Thursday, April the 15th at 11:30 at 3106 South Woods Avenue, Linden, New Jersey. Okay, that's in Linden. So if you're interested in getting your CDL license, or you can call 908-862-3252. Those who are interested in getting their CDL license, please call that number. We'll be posting it. Again, parking advisory update. Please be advised that effective May the 1st, 2021, the City of East Orange, we are continuing to enforce our overnight parking parking. So again, if you have any concerns, call the Housing Authority, 973-672-1116. Again, we continue to do our food distribution, 90 Horstead Street, starting at 9 a.m. on Saturday. So if you are needing food, or you know someone that needs food, continue to utilize our food distribution. First-time home buyers, first-time home buyer workshops. If you're interested in purchasing property here in the City of East Orange, on Tuesday, April the 27th at 6 p.m., featuring Realtor Mayo Martin with Premier Properties will be offering the classes for first-time home buyers. For information, register, go on Facebook page at East Orange City Hall, or call 973-266-5411 extension 5398 to get information. Don't forget about our recreation department programs that we have for young people, including basketball clinic, chess, bingo, family feud, fitness, paint, and sip and paint. Oh, that's good. Please call 973-414-4141 for any information. Those who need the animal control, again, we got, you can call over to our health department. Also, the free COVID testing. They got free COVID testing at Elmwood Presbyterian Church, located at 135 Elmwood Avenue. We'll be hosting a free testing on this Saturday, April 17th at 10 a.m. To register, please visit bwhcsurvey.com. Registration is required. Also, let me see. We already talked about the transportation, free tax preparation, East Orange. You need your taxes done and you make under $64,000, please call 862-241-9491, Monday through Thursday, 12 p.m. to 5. Again, East Orange, as we close out, we still have money for rental assistance. If you're having problems with your rent, please call our Department of Policy Planning and Development, and someone would help you. With that, East Orange, we're going to close out. Again, we thank Dr. Mehta, we thank Victor Cote, Dr. Griffin. We thank my team who week after week, we do this faithfully, from Marco to Rashawn to Connie to Precious and no other than Audrey, who's making sure that you understand what's going on in sign language, and Tony Jackson. With that, East Orange, we're going to close out. Thank all y'all for joining us. Let's stay focused. Let's continue to practice social distance. Let's wear those masks. Let's stick together. Let's continue to support each other. Let's continue to reach out to each other. Don't stop the love that we've been showing each other for the last year and few months. We've been doing a good job, and let's continue to do that. We don't have to have something to happen or something tragic to happen to be who we are, and that is to continue to reach out to your family members, continue to reach out to our seniors and the elders in our community, continue to reach out to your neighbor next door, continue to support our young people, and continue to support each other. So with that, may God bless you, may God bless your families, and may God bless the city of East Orange. Until the next time, East Orange, love y'all guys.